everyone, this is Chadi Alraies from New York EVS 2024. I'm really privileged to be with Dr. Michael Trepal, who is the Dean of New York Podiatry School of Medicine. Dr. Trepal, thanks for being with us.
Oh, it's my pleasure to be here. Thank you for having me.
This is a phenomenal venue where it's very rare to see the collaboration between endovascular, vascular, and podiatry coming together. So tell us about this collaboration and where it came from.
Well, it's a marriage made in heaven. In podiatric medicine, we see ischemic feet all the time. We see patients with claudication, we deal with patients, certainly diabetic foot, and ischemia is a considerable part of that. And we need the intervention of vascular colleagues to get the blood flow down there so we can do what we need to do to heal the wounds. And this is all about limb salvage. And multiple studies have shown that interdisciplinary care is the best care. The collaboration of multiple specialties working together is a give and take. We have our vascular colleagues come and lecture to our students at the Podiatry College, and our faculty go and lecture about the things that we do to the wound care fellows and the vascular fellows, the interventional fellows. So this cross-fertilization really has at its ultimate goal patient care and improvements in patient care.
I mean, definitely people or patients who have foot issues, usually, or ischemic limb, usually you are the first person to see them as a practicing physician. But I don't see that harmony in the system between podiatry and vascular elsewhere, everywhere in the United States. Here you have a perfect setup. It's phenomenal, the track and all that education. But how we can amplify that collaboration and make it nationwide?
Well, you know, at the national level, there is collaboration between the Society for Vascular Surgery, SVS, and the American Podiatric Medical Association. Has kind of come up with the euphemism of toe and flow to try to how it goes together. So yes, between the parent organizations, there is that collaboration. I guess all politics is local, and in some health systems, it's more robust than others. Yes. Certainly here in New York, it is quite robust, and I think any podiatric physician worth his salt, works with a vascular person, whether it be a surgical or an interventional, to help get the blood flow down to the patient's foot where we can do what we need to do.
Yeah. From our endovascular space, usually we teach the fellows and residents, like everybody with a foot ulcer, you have to look for PAD. You are the Dean of Podiatry School. Do you, is it embedded? I'm assuming it is, but we don't know what you teach to your resident, how to, importance of ischemic evaluation, and if it's possible to be done in your office?
Oh, absolutely. I mean, podiatric physicians are adept at identifying vascular disease. Once identified, then we need to make the referral to a competent vascular interventionalist or surgeon who then can fix the vascular problem. And let me add here also, as you're a cardiologist, so you know that PAD means CAD.
Right.
And I refer a fair amount of patients to cardiology as well. And not infrequently I'll get a call back from cardiologists to say, this patient had a lesion that was ready to go, and we were able to do an intervention. Right. So it transcends just local peripheral vascular disease. Certainly coronary disease and carotid disease. I don't have to tell you, you know better than me about how systemic vascular disease is indeed systemic.
Absolutely. Well, Dr. Trepal, thank you so much for your time, and thank you for giving us an overview about this great collaboration that's happening in this conference and also throughout New York, and how this is kind of ultimately bottom line to take care of the patient as a whole, from wound all the way to endovascular, and promote and expedite healing.
Well, thank you so much, and I appreciate your efforts to do it.
Thank you so much.
Have a good day.
Thank you so much. Yeah.